guys, one last video to finish up Unit 1. Last video we left off talking about the planes of division, and I introduced the sagittal, horizontal, and frontal plane. Well, let's have a quick talk about those and then move on to the next topic. So if we were to look at a frontal plane, we're assuming the body is going to be sectioned so that we divide the body into a posterior, which is the back part of the body, and anterior, which is the front part of the body section. Sometimes you'll hear this called a coronal section because it cuts through the crown of the head, but for our purposes we'll call it the frontal plane. A sagittal plane is one that's going to divide the body into left and right halves. It can be equal halves, so if we split the body right down the middle, the internal structure won't be equal, of course, because our internal organs are not exactly mirror section, but the outside of the body would appear equal left and right halves. Now those are called a mid-sagittal section. But you should also note that a sagittal section can occur anywhere along the body as it travels down the body's axis, so you could have a sagittal section that's cut that way just as well as a mid-sagittal section. So keep that in mind. Now, a horizontal plane is going to be one that cuts the body into a superior and inferior section. So there's going to be a top half and a bottom half. Of course, this isn't going to be divide the body in equally or anything like that, but it's often how we section stuff, especially for labs, when we give it a cross section. And it's important to note that a horizontal plane can go anywhere anywhere perpendicular to the main axis of the body. So you can have horizontal planes going anywhere in that direction. You end up with a superior and an inferior section. Alright, the last topic of this unit is talking about body cavities. Now, the body has many cavities and they serve a lot of different purposes. One of the major things, of course, that they do is they serve to protect the vital organs that are located within them. So if you have a look at the picture on the right hand side there, you can see the body cavities that you're responsible for in this unit. So with the cranial, the vertebral, which make up the dorsal cavity, then we have the thoracic, the abdominal pelvic cavity, which make up the ventral cavity. So let's have a look at those. So, two functions to a body cavity. First, protection. Okay, organs that can be quite delicate need to be in a space in the body where they won't be harmed. So our central nervous system, our brain and spinal cord are located, actually so important, they're located inside cavities, inside bone. So maximum protection. Another thing a body cavity does is it will allow some organs to change in size and or shape. So think about after you've had a really, really, really big meal and your stomach just feels so full. The fact that your stomach is inside a body cavity allows it to stretch so it can accommodate a big meal and then go back to normal size later. If it was stuck inside against all kinds of other organs or mashed up against bone, then it wouldn't have that flexibility. So protection and allowing body to have that plasticity or flexibility. So we're going to have a look at a couple of different body cavities in this course. The first one we're going to start with is the dorsal cavity, and if you think about your anatomical terminology, the dorsal cavity is located towards the posterior of the body, and it's going to have two cavities inside, it's made up of two cavities, the cranial cavity, which is going to house the brain, the central nervous system, and the spinal or the vertebral cavity, which runs down the inside of the spinal cord, the vertebral column, and it houses the spinal cord. So that makes up the dorsal cavity. On the ventral cavity, we have a couple of different divisions. The first one is between the thoracic and the abdominal pelvic cavity, and this makes up the ventral cavity. You can see on the picture here, they also have the pelvic cavity. Get that word mixed up. But for our purposes, I'm just going to talk about the thoracic and the abdominal pelvic. So the abdominal pelvic will have the abdominal and the pelvic cavity together. So two body cavities, each one's divided into two smaller regions. Another thing that anatomists often do, especially when we're talking about our abdominal, the abdominal part of our body, so basically our guts from our chest down, is we divide them up into quadrants. If you've ever seen a police show or an ambulance show and you hear the ambulance bringing in a guy who's been in a car accident or wounded or something, they say, oh, he's got a puncture wound in the left upper abdominal cavity, or left upper abdominal quadrant. And this is a way to convey information to a doctor or another anatomist so that they understand what part of the body you're talking about. Now, in order to get these quadrants, what we do is we draw a line. First, we draw a transverse plane that goes through the umbilicus, which is the belly button. So a line straight across the belly button, and that's this one right here. And then from there, we do a mid-sagittal plane, a medial plane, that goes right down the center line of the body. So at the belly button is the apex of the center of the grid, and then from there we get our different quadrants. Now we just talk about some of the organs that you'll find in the different type of quadrants. By saying this, you're going to convey information to somebody else in the know about what organs or what structures are located in that part of the body. So the upper right quadrant are going to contain some of the liver. You're going to find the gallbladder. You're going to find parts of the small intestine, parts of the pancreas, the right kidney, and a part of the large intestine. Now if we move to the left upper quadrant, we're going to have the other part of the liver. We're going to have the spleen, most of the stomach, most of the pancreas, the left kidney, and another part of the large intestine. So you can tell there's some things that are similar and some things that are different based on where they are in the body. So if you said to somebody that somebody had a wound in the upper right quadrant, then they would know that it's probably not going to involve the spleen. It won't involve the left kidney. It may involve a bit of the pancreas. It may involve a bit of the large intestine. But by knowing what's in each one of these quadrants, you're conveying information quite quickly. And then finally, we'll look at the lower quadrants. So the right lower quadrants is going to contain the appendix. If anyone's ever had an appendicitis, which is an infection of the appendix, you'll get pain in your lower right quadrant. And if you go to the doctor and say, you hold your side and you say, I have pain there, the first thing the doctor is going to think about is, I better check for an appendicitis, which is an infection of the appendix. So it has the appendix, a part of the small intestine, a part of the large intestine, and some of the reproductive organs. Now, the lower left quadrant is going to contain mostly the large intestine and, again, some of the reproductive organs. So that's how anatomists divide up the abdominal cavity or the abdominal region to give each other ideas about what structures are located in each one. All right, that's the end of Unit 1.